I want to introduce first Lucas Bechtel, who is with the Bryan Times, and Lucas agreed to do an interview of two of our top physicians in Williams County. So I would like to introduce Dr. Glenn Seaman, who is with Parkview Physicians Group, and I'll ask him here in a minute how long he's been a family physician, but he has been a family physician. He is currently also the Williams County Health Department's medical health director. So Dr. Seaman, how long have you been a family physician?
I've been a family physician for 21 years now, Bill.
Fantastic, 21 years. So thank you for being here this morning. And I also want to introduce my very good friend, Dr. Park, who is a family physician, obviously, with Parkview Physicians Group. But he is also the Williams County coroner, so he is not someone you want to run into in the middle of the night. You can help it. And he's also a medical director of various nursing homes in Williams County, and so we're happy to have him. So Dr. Park, how long have you been a family physician?
I've been a family physician since 1992, 29 years.
Fantastic. So we have 50 years of experience sitting across the table here in terms of being family physicians or medical directors. And I'm gonna make one comment, and I'm gonna step aside and let Lucas, kind of take over the interview. But the comment I want to make is that, we have kind of a good news, bad news scenario developing in Williams County. The good news is that we're moving down in our cases per 100,000 residents. We're currently at level 2, which is still orange. We're knocking on the door of level 1, which is yellow, and that's where we want to get to. We're currently reporting about 109 cases. That's 109 cases per 100,000 residents, and we got to get below 100. That's what we're trying to get below, and we've been trending that direction, and that's the good news. Everybody's still trying to do the right things. The bad news is when it comes to a COVID-19 vaccine, we're really trailing the state and national averages in terms of folks getting vaccinated. We're trailing about 10 percentage points behind adults over the age of 18. So in the United States and in Ohio, just over 50% of adults over the age of 18 have received the COVID-19 vaccine. In Williams County, that number is 40.5%. So we're trailing by almost 10 points. And that's a little bit concerning because we do not want this thing to come back in the fall, because that's probably where we're headed. We have to have more success getting people vaccinated. So I wanted to pull this interview together to share information about the vaccines. And I asked Lucas, who is one of the youngest reporters at the Bryan Times, to come in and ask some questions. So it's going to be kind of an open conversation with Lucas's questions. But before we start, everybody in this room has been vaccinated fully. And we waited our 2 weeks. And because of that fact, we're going to take our mask off, because for us, things are getting back to normal. This is going to be a normal interview like we would have done pre-COVID. And it feels so good to take that mask off. And that's one of the benefits for getting vaccinated. So I want to do this, Lucas. I want to ask the physicians if they want to make any opening comments to start, and then roll it to you for questions. How's that?
Sounds good.
Kevin, why don't you go first, if you don't mind?
So we are here today because we are, I think I'm speaking for Glenn in this respect also, that we're dedicated to making a difference in our county, in our country, and in the world at trying to reduce the spread of COVID-19 and reduce the associated hospitalizations and death. And we think the most important part of that process is getting as many people as we can vaccinated against it. So we want to come here today to share some information that might help someone who is on the fence about whether they want to get it or not. and we want to share some information that might change some minds, might reassure some people, but certainly share some facts that will lead everyone to believe that there can be an end to this and there can be a return to normalcy again. Thank you.
Thank you, Kevin. I agree. I'm very passionate about the COVID vaccination. There's great science behind it. There's great efficacy. I think that it's important for people to understand from a medical perspective really what the COVID vaccine can do, as well as other vaccines that we've had in this country. It's very similar. The purpose of vaccination is to end disease. And from a medical perspective, it's important for people to understand that. This is not something that is a political move. This is medical, this is health, and it's important for people to have that understanding from physicians, not necessarily what people may hear in the media, on social blogs, or so from physicians, from the CDC, from the health departments, that's people's best source of information about the vaccine.